Hi, this is Christopher Westfall with an urgent announcement that's very timely. This is May 6, 2020, and we're talking about your opportunity to join Medicare. Maybe you missed the opportunity and you were supposed to have started on Medicare Parts A or Part B, but because of the coronavirus pandemic, you couldn't get that done for whatever reason. As you know, Social Security offices have been physically closed to you going in there and meeting with a counselor. This has greatly affected people who've lost their employment or for whatever reason have left their employment after the age of 65 and now need to prove to Medicare that they're eligible for benefits without any penalty. A new opportunity has just presented itself with the Center for Medicare and Medicaid Services acknowledging the existence of the pandemic and granting a waiver an extended period of time where you can avoid getting a penalty for starting Part B late. Stay tuned, this is very important. Hi, I'm Christopher Westfall, an independent broker for Medicare insurance. Our service doesn't cost anything. Today's announcement from the Center for Medicare and Medicaid Services is huge. A lot of seniors have gone past 65 years old, were working for an employer plan, but during the pandemic of the coronavirus in 2020, for some reason had to leave that employment. Either they were laid off, furloughed, whatever, and they're losing their group coverage. Well, you have to prove to Medicare, if you waited past 65, that you've had qualifying coverage this whole time. Usually that happens when you go into the Social Security office and meet with a representative with a signature from your employer showing that you had credible coverage the entire time since your 65th birthday. That was not able to happen in a lot of cases. We cover over at my website called howtostartmedicare.com how you can do that. Again, that's howtostartmedicare.com. Even during the pandemic, we've been working with Social Security to find out what their requirements were, and that's covered over there on the website. However, this is a new opportunity for whatever reason for those people who have missed those opportunities to do that during a timely fashion. Otherwise, you might have a penalty if you start Part B later. If you just go online to start Part B and you did not get the employment verification form, again, for people working past 65, then you would automatically be assigned a penalty on Part B that lasts for the rest of your life. We want to avoid that, and now we can for a limited time period. I'm going to go through this announcement in its entirety. Sorry for reading to you, but this is critical that you have it. I'll also link below in the description to not only this announcement, but also the frequently asked questions, which I'll cover in just a moment, and see how this pertains to you. All these updates will always be updated in real time over at howtostartmedicare.com. So this announcement coming out May 5th, 2020, new COVID-19 related enrollment flexibilities. Medicare Part A and Part B enrollment equitable relief for the COVID-19 pandemic-related national emergency. So geography-based, this is the entire country of the United States. It says the Center for Medicare and Medicaid Services, otherwise known as CMS, is taking further action to ensure beneficiaries have access to the critical healthcare coverage they need in the wake of the coronavirus outbreak. CMS may provide equitable relief if circumstances described in the section of the Social Security Act occur. Equitable relief may be in the form of extra time for certain eligible beneficiaries to enroll in Part B or the premium paying part of Part A, or refuse automatic Part B enrollment. In addition, eligible beneficiaries would not be subject to a late enrollment penalty for the period between the original enrollment period, that's when you're first eligible, and the enrollment during this extension of the enrollment period. Beneficiaries are eligible for equitable relief due to the COVID-19 pandemic-related national emergency if they were unable to make their Part A or Part B enrollment choice in a timely manner due to delays and problems with access to the Social Security Administration to file an application or enrollment election as a result of the unexpected closure of the field offices due to COVID-19. We've been expecting this for months. It's finally here. CMS is granting equitable relief in the form of additional time to use an initial election period. Typically happens when you're 65 years old or when you're starting after leaving an employer plan, when you work for an employer with over 20 employees in that big company, so that you were eligible to offset your Medicare, to delay it until later. Even talking about additional time for the general enrollment period or a special enrollment period, such as the special enrollment period when a beneficiary's enrollment in employer coverage based on current employment ends. That's what we're talking about mostly here. In order to file an application for Part B or premium Part A, or even to refuse Part B. This equitable relief will last from March 17, 2020 through June 17, 2020. It's going to be retroactive. Beneficiaries are eligible for this equitable relief if, this is critical, if the beneficiary had an enrollment period during the period from March 17th through June 17th of 2020 that was either an initial election period, the general enrollment period for Part B, or a special enrollment period. The SEP is leaving the employer plan. That would be one of those. Or if you just turned 65 and for whatever reason you just got too busy with life to sign up for Part B, this also would apply to you. And the beneficiary did not apply for Part B or the premium version of Part A, saying you didn't have enough credits, or refused Part B during that IEP, GEP, or SEP. Eligible beneficiaries who wish to take advantage of the equitable relief must file their enrollment request by June 17, 2020. Individuals who are eligible and have a valid election period between March 17th and June 17th and are not already enrolled in Part A should apply for Part A online first at ssa.gov/Medicare, benefits/Medicare. We'll have that link below. Individuals who already have Part A, this is the majority of folks, who already have Part A and wish to sign up for Part B cannot sign up online. I've been saying that for a long time. You can't sign up online and just make this automatically happen. Individuals interested in using the relief to enroll in Medicare Part B coverage who are eligible to apply under their initial election period, typically turning 65, or the general election period, you waited too long to start for Part B, should complete CMS Form 40B. That's just the typical application for Part B. And mail the request to their local Social Security field office. We have a link as to how you can find your Social Security office below. It's also on my website called howtostartmedicare.com. Individuals who are receiving Social Security benefits before their 65th birthday are considered to be in their initial election period and are automatically enrolled in Part A and Part B when they turn 65. Those who do not want to be automatically enrolled in Part B must refuse the coverage within 60 days of receiving their IEP package. That package comes from Social Security with your Medicare card in there. They're assuming, again, if you're drawing Social Security income prior to age 65, they assume that you want Medicare to start at age 65. If you don't, or if you didn't, you needed to send that form back in, your card back in within 60 days. Let's see, where did I leave off here? Okay, instructions on how to refuse the coverage are included in that letter. Individuals may also contact the Social Security Administration at 800-772-1213 for information on how to refuse the coverage. Individuals interested in enrolling in Part B coverage who are eligible, this is the majority, folks, this is the big one here. If you're interested in enrolling in Part B coverage and you're eligible to apply under the special election period, that's losing your employment coverage, should complete both Forms 40B, that's the initial application for Part B, and CMS Form L564. That's the one where the employer signs off that since you were 65 and to the time you're leaving the employer, you had creditable coverage. They just have to sign that form. Both forms are available in English and Spanish versions. The CMS 40B is completed entirely by the individual. For the Form L564, that's the employer side, enrollment form must be completed, if feasible, by the employer. It says Section B on that form can be completed entirely by the employer, or if it's not feasible for your employer to complete the form, many are shut down right now still, then you can leave this section blank and provide at least one of the items below as acceptable proof of the employment that you had. Let's say you can't get with the employer, then you can just leave that section that they would have signed blank and send in one of these items of proof here. And so you're going to show items of proof of your group health coverage plan or your large group health plan. You can send in an income tax return that shows that you paid insurance premium, your W-2 showing that you had pre-tax medical contributions last year, pay stubs that show that you were paying for health insurance premium, an explanation of benefits provided by the group health plan, or a statement or receipt that reflects the payment of health insurance premiums. You simply just have to prove that you've really had health insurance during that period. Individuals can fax their completed enrollment forms to the Social Security Administration at 833-914-2016. I don't recommend that because now they've just opened this fax number up within the last couple of months for these forms. And I'm sure that that is a one-stop feed-in funnel for the entire country. That's backlogged. And plus faxes are at 150 DPI, which is really hard to read sometimes, especially if it's handwriting. Or the better option, mail it to your Social Security field office. Again, the addresses for that can be found at ssa.gov or on our website, howtostartmedicare.com. Although SSA offices are closed for in-person service, requests received by mail are still processed. Individuals can find the address and phone number using their website. Here's a tip for you. This is what they told us. It's nice, better for them, if it comes in a large envelope, not folded in just a regular old, whatever that is, envelope, standard number 10. If you send it in a large envelope, preferably overnight would be good, or priority mail would be good, and write urgent on the outside, preferably in red letters, urgent, because this is timely. It's got to be done soon. Then that will stand out from the pack and they can likely get to that first. That's what they told us. This assistance is being available retroactive to March 17, 2020, and will continue for a 3-month period that ends June 17, 2020. Beneficiaries need to have qualified for and missed an enrollment opportunity during this period for this to apply. Eligible beneficiaries must submit their delayed enrollment request before June 17, 2020. It's also important what they told us in the notes section on your Form 40B when you're asking to start on Part B yourself. If you'll put in there when you are requesting this to have started, or if this doesn't apply to you and you're just now starting through the process and you didn't miss any time frames, when you are requesting your Part B to start. Typically, they'll start it on the first of the next month after they receive your paperwork. But hear me here. If you're doing the Form 564, that's the employment form, that has to be looked at by a human being. And that's where the backlog happens. It has to be looked at by somebody who says, yep, this is credible coverage, or the employer signed it, or this is acceptable proof of the medical ID card or premiums having been paid. Yes, this person qualifies with no penalty to go forward, and they'll typically try to start it, if they can, if they get it in time, on the first of the next month. So if you wanted a different month selected, like 2 months out, and you just left your employer plan, you need to write that in there in the notes section when you're requesting it to be fixed. If they got it wrong, like some of our clients are finding because they didn't put that note in there, you can call Social Security and typically they'll help you with that, but their phones are backed up. That's why, again, I don't recommend that you fax it to them, that you literally mail it to your local office. Their burden, their workload will be much lower. It's not that you have to go to your local office, it's just that that's going to be faster for you. So again, this period, for those who missed that opportunity or for whatever reason couldn't get that form done by their employer, whatever, and your period was in the middle of this, March 17th through June 17th, you can have this done now. Let's see, talking about disabled, who qualifies, what's Part A, what's Part B, you can see that later. Part B is typically when you're turning 65. Most important is, let me pull out their frequently asked questions PDF that they've sent along. It starts with enrollment issues for COVID-19 pandemic-related national emergency, questions and answers for Medicare beneficiaries. Question 1, I missed my opportunity to enroll in Social Security Administration because they were closed, and I didn't know how to submit the application or was not able to get my questions answered through other governmental communications channels during the public health emergency caused by the coronavirus outbreak. Can I have more time to enroll in Part A and Part B? Yes, that's what this is for. Retroactively to effective March 17, 2020, equitable relief is available for eligible individuals who could not submit a timely enrollment due to the impact of COVID-19. They call it 3 different things in here, that's funny. Pandemic-related national emergency had on SSA's processing. To be eligible, the following conditions must be met. You must have been in your initial enrollment period, that's turning 65 generally, general enrollment period, or a special enrollment period, like losing employer coverage, that happened between March 17th and June 17th, and the individual did not submit an application request to SSA yet. Individuals who already used their IEP or GEP or SEP to make enrollment election are not eligible for this equitable relief to change that election. Once it's done, it's done. If you already did it, it's done. Eligible individuals will be given an extension of their period in order to have extra time to enroll in Part B or the premium paying part of Part A. That's someone without enough credits, without penalty. Or they can refuse automatic Part B enrollment retroactively if you forgot to do that, didn't know what to do, got too busy during the pandemic. This assistance is available from March 17th through June 17th. Question 2, does an individual need to show proof that they were not able to apply or submit the application request because of the pandemic? No, they do not have to show proof that they were impacted. They will need to meet the eligibility criteria for equitable relief and submit an enrollment request between March 17th and June 17th. You just have to meet the eligibility requirements, like this was your returning 65 period and you waited too long, or you did leave the employer plan at some point during this crisis and you could not get that form to Social Security. You don't have to prove that, you just need to get it in now. Question 3, what should people do to take advantage of this equitable relief? Individuals who believe that they're eligible should contact the Social Security Administration to apply or enroll in Medicare as follows. Individuals can apply for Part A and Part B online right there. But individuals who already have Part A and wish to sign up for Part B cannot sign up online. Individuals interested in enrolling Part B coverage who are eligible to apply under the IEP or GEP should complete Form 40B. That's the general enrollment request for Part B that does not require proof from an employer that you've been deferring your Medicare option. This is the one that's most important right here. Individuals interested in enrolling in Part B who were eligible to apply under the SEP, the Special Election Period, losing other coverage, should complete both Forms CMS 40B, that's the application for Medicare, and Form L564, the Employer Verification Form. Both forms are available in English and Spanish. The 40B should be completed by the individual, and the L564 should be in the Part B, Section B of that form should be completed by the employer, or if that's not possible, and this is the first time that's available, if you can't reach the employer or that's not possible, just send in proof, and the proof is listed there. Again, you can fax it in, I don't recommend it, or you can address it to the local office. Also, another good idea is get proof that you sent it, like, you know, the fact that it's sent by priority mail and the return receipt requested, that kind of thing would be helpful. Question 4, if I enroll in Part B or Part A under this offer of equitable relief, when should my Part B or Part A enrollment take effect? The effective date would be the month that would have been granted had the application been filed at the time of the individual's original IEP, GEP, or SEP. So let's talk about that. If they say that you're, let me give you a scenario. You're not drawing Social Security income, right? You're deferring that, let's say you're deferring it until you're 66, 67. And we know that that'll give you an extra 7 or 8% per year in your income. So you're just deferring your Social Security draw. So there's nothing for them to draw the premiums from. And now you're starting Part B later. If they retroactively start you on Part B 2 months ago, they're still going to be sending you the statement saying you need to pay a quarterly payment. That's the option, a quarterly payment for your Part B premium. Now, typical in 2020, that's $144.60 just to have Part B. Part B, for those that don't know, is the outpatient part of Medicare. Your x-rays, your laboratories, or your lab work, outpatient surgery, doctor office visits, all those things that are not admitted into the hospital. That's Part B, and there is a premium to pay for that. If you're a higher income, then you'll be paying more than that. Typically, that starts at around $80,000 a year. There's different categories, and you can see that. That's called IRMA, income-related Medicare adjustment based on the premiums you're going to be paying based on higher income from 2 years ago. I've got a whole video that talks about that and how to get out of it if you qualify, and many people do because they're leaving high-paying jobs. But you have to pay that premium in a quarterly payment physically by writing a check and sending it in if they can't draft it from your Social Security income because you're not taking Social Security income. The better way to do that, trust me on this, please, is to go online on your MySSA account, on your Social Security account, and set up a payment to make your Part B payments drafting from your checking account. I know many people say, I don't want anything touching my checking account because they can just go in there and run it dry. On your Medicare, on your premium, this is one thing you do not want to expire. After a 30-day grace period, they could take that away from you if they don't get your premium payment. And right now, they have so many manual payments to process, you don't want yours to get lost in the shuffle. You never do. Always a bad idea to send a check in if you ever have to. Back when I worked in law enforcement at the sheriff's office, I would do identity theft seminars all the time. And somebody stealing a check from the mailbox and whitewashing that and using your checking account to get access to your account is far more dangerous than direct deposit is. Trust me. So it's better if you go online at Social Security once you're approved and set up your payment method to come out of your checking account every single month, rather than every 3 months getting sent a statement that you have to send in a check and hopefully not miss that. Same can be said for a Medicare supplement plan. If you get Medicare supplement insurance, it's far better to have it draft every month so that you don't risk losing your coverage. Because in most all states, if you lose your coverage, you'd have to qualify again based on your current health at the time, which may mean you can't qualify at all. So just on your Medicare related insurance, I highly recommend you set it up on monthly bank draft, not even a credit card if it was an option, because those expire routinely as well. And if it expired and you missed the notice, again, you could lose your coverage. I digress. Sorry about that. Just a tip based on experience. It's a nightmare when somebody loses their Part B because they missed mailing in a payment or somebody lost it in the mail. Question 5, if I miss my opportunity to enroll and take the extra time under this offer of assistance to enroll in Part B or Part A, will I be subject to a Part A or Part B late enrollment penalty? No, that's the whole point. Individuals who use this equitable relief to enroll in Medicare will not be subject to a late enrollment penalty for the period between their IEP, GEP, or SEP would have ended and their effective date of coverage. Individuals who would have had a late enrollment penalty if they timely enroll, will have that late enrollment penalty applied. Oh, so if you're going to have a late enrollment penalty before this, you're still going to have one. This is only applicable to the people who, during the pandemic, could not get this done. This does not waive any prior things. Now, we've also received notice from insurance carriers on the Medicare Advantage and the Part D plans, saying that they coincide with this, obviously. So if somebody is losing their employer coverage, they're just now starting on Part B, that's their special enrollment period. Now they're brand new to Medicare. That opens up all those opportunities for Medicare Supplement, Medicare Advantage, or Part D drug plan. So if you're frustrated or you know somebody who's over 65 who lost their employment and they've, for whatever reason, they've been paralyzed by the fact that they can't get out of their home, they're under a lockdown order, no one's answering the door at the Social Security Administration, it's an hours-long wait time to call them on the phone, please share this information with them. Now is their opportunity to get this done now, get it done in a timely manner with no penalties. It reopens that window. If they missed it before, they can get this done. And they can also get Medicare insurance to go along with it, as those insurance-related options are triggered by your enrollment, your start into Medicare. My name is Christopher Westfall. If I can help you in any way, please start on my website called howtostartmedicare.com or seniorsavingsnetwork.org, or you can call us at our toll-free number. We just help seniors. Our cost is absolutely zero. I'm just here to help, and I thought that this is a very timely message to get out there to a lot of people who, for no fault of their own, have lost their employment coverage or their employer coverage, or they've maybe negotiated their way out. They took a severance, they took a settlement, and they left. And those people need to know that this is now an option if they did not get it done before. That's what we help with, and all of your options. So please contact me if we can be of assistance, but please share this with somebody who might need to know this. Thank you so much for watching. God bless you, and we're here to help. Take care.